All right, so we're about to look at a very long and simplest question in this exam. The question is long just to make people get scared, but in the summary, they're just trying to look at body mass index, how to calculate body mass index, the effect of obesity, how to measure waist circumference. It's very, very simple, right? But they made it so long. Just see. But the answer is just one, two, and that's all. Okay. So let's look at the question. We said that what a 40-year-old woman was weighing what 75 grams. This grams you have to convert it to kilograms. So that's what 75 kg. All right. And she's 155 centimeters tall. Convert these centimeters to meters. That's what 1.5 meters only. Okay. So she actually made multiple attempts to lose weight for the past 8 months. So that lose weight there will now what start making you think about obesity. Okay. So she eventually what dropped 500 grams. Okay. So 500 grams now. Okay. Okay. She dropped 5,000 grams. Sorry. Okay. So when she dropped 5,000 grams, she regained what 2,000 grams. Okay. But she can't resist sweets. Okay. So she is moderately what hypertensive. She's on a diuretic and an angiotensin enzyme inhibitor drug. She has osteoarthritis of both knees as well as what? Severe obstructive sleep apnea. Okay. So she uses continuous airway pressure nightly during sleep. So what are the questions? These are the questions. Calculate the BMI and classify the patient appropriately. So calculating this BMI, first of all, you say that what? She gained 2,000. So she lost 5,000. So that was actually what? 3,000. She actually lost 3,000 total. So her weight is actually what? 72,000. Okay. So that's what? 72,000. That's just a small calculation there. Okay. So let's move. Then list 5 possible complications of the disorder in this patient. So mention one important hormone likely to be implicated in this disorder. List 2 important clinical tools used in assessing obesity, and which one is what preferably. So they eventually mention the obesity that they're trying to ask you about. So let's move. Okay, so moving on. I went to arrange the calculation, but it's fine now. So just like we said, the woman was actually 75 kg. So she lost 5 kg. 5 kg is 5,000 grams. Okay. So she regained 2 kg. You get. So you now say 5 kg minus 2 kg, that's 3. So that means actually she lost 3. Okay. So you now say what? 75 minus 3, that's 72. Okay. So you work with 72 kg, which was 72,000 grams. Then her height was 155 centimeters. That's what? You convert it to meters, that's what? 1.55 meters. So what is the formula for calculating BMI? That's the question 1. Calculate BMI. You divide the weight of the patient by the height, but you square the height. Okay. So the weight is what? 72 kilograms. The height is what? 1.55 meters. So you square 1.55 meters. It will give you what? 2.4025 meters. So it's now 72 divided by that. So it will now give you what? 29.96. Okay. If you abbreviate it, it's what? 30. Okay. So I think that's it. So what will be the unit? The unit will be what? Kilograms per meter square. Right? Kilograms per meter square. That's the what unit for that. All right. So for the next question, they said that you should, okay, first of all, you classify before you now look for to check if the patient was obese or not. So we actually got 29.96. So 29.96, if you approximate 29.96, it's actually 30. All right. And looking at the obesity class 1, It's actually from people that have BMI of 30 to 34.9. So she was just what? Obese. Okay. Now, what are the 5 possible complications of obesity? I brought the picture here. This picture contains almost everything. Okay. So 5 possible complications is what? Cardiovascular disease. There's increased use of heart disease, hypertension, or stroke. Type 2 diabetes, there's higher likelihood of you developing what? Insulin resistance and diabetes. Osteoarthritis, like she had, is there will be greater stress on your joints, okay, for them trying to bear your weight, okay, and this will lead to joint damage, okay. Then there will be obstructive sleep apnea, like she had, okay. So they actually even gave you all this thing. So she was not saying she has sleep apnea, you get. All right. So this is worsening of sleep apnea. They are struggling to sleep. Okay. So this is due to what? Excess weight and fast deposition around the neck. Okay. Okay. Sleep apnea is like when you are sleeping, something will obstruct your throat and you'll not be able to breathe again. So you have to wake up. Yeah, that's obstructive sleep apnea. There'll be metabolic syndrome. Metabolic syndrome is a cluster of conditions, including high blood pressure, high blood sugar, excessive body fat around the waist. Okay. So now the best way for you to now test if somebody has obesity is measuring what? Waist circumference to see if there's abdominal obesity like this. Okay. So what is one important hormone that can be implicated in obesity? Is leptin. Okay. So leptin is a hormone that produces fat cells and also helps what? Regulate energy balance by inhibiting hunger. So in obesity, leptin resistance can occur, leading to an inability to what? Effectively regulate your appetite and weight. Okay. So what are the 2 important clinical tools for accessing obesity? The other one is BMI. Okay. So BMI is just like we calculated. You divide what? The person's weight all over the square of the height. Okay. Then the next one is what? Waist circumference. Just like this. All right. But waist circumference is actually the best one. Best one. Okay. So this one measures abdominal fat, which is a key risk factor for metabolic and cardiovascular disease. So what is the preferred tool for diagnosing obesity? This waist circumference is the best one for measuring obesity. Okay. So with that, I think we have done it. This was the last question. List 2 important clinical tools using or accessing obesity, and which one is preferable in clinical practice, which is actually waist circumference. Okay. So that's a body mass index clinical case talking about obesity, complication of obesity, hormones involved, and clinical tools used in diagnosing obesity.